have devised proprietary processes and protocols for rehabilitating patients both with brain injury rehabilitation and spinal cord injury rehabilitation. Now, brain injury rehabilitation has remained an enigma for most people, even for neuroscience professionals and the public at large. People do not understand that the physical healing does not automatically convert to a functional outcomes in most times. So this is where a customized process of brain injury rehabilitation plays a very big role to helping such patients who are totally dependent or bound to the bed to be able to get back into the community with varied levels of independence. This unique model for brain injury rehabilitation that Neuro has devised is called the coma to community. This is a cognition-based model where cognition is the complex brain system processing that all of us go through to make sure that we deliver the appropriate tasks that we have to deliver in the appropriate way to make sure that the patient becomes functional in the community. Brain injury rehabilitation has remained an enigma for most people, including the neuroscience professionals and experts. Physical healing of brain injuries and insults does not automatically translate to a good functional and complete functional outcomes. The complexity and the uniqueness of every individual's brain functioning and the fact that most of it cannot be measured well and even in a standardized way makes this task very complicated. This lack of clarity at all levels has resulted in creating a large number of neurologically disabled patients who are now a liability for the family, the community, the society, and the country. Unlike age-related degenerative disorders, many of these individuals who are in this situation following a road traffic accident or a stroke especially, or other injuries like because of neuroinfections, were normal, productive breadwinners of the family and the community. And these problems devastate not only the family and the community but eventually the whole country. With the rapid growth of the population and industrialization and the huge number of vehicles on the roads on one side, and on the other side, lifestyle problems, inappropriate diets, lack of exercise, and this rat race that people are in, strokes are started affecting younger and younger groups of people. This unique model of coma to community, the brain injury rehabilitation process devised by Neuro, starts right from the intensive care unit 1, 2 or 3 days after the brain injury or insult, once the patient is medically stable, even on the ventilator, all the way till the patient is ready to get back into his community, his occupation or otherwise. So this is a completely whole process that covers end to end of rehabilitation, covering all aspects of rehabilitation. This has been protocolized. We have got steps at every level. We have devised our own equipments at every level to make sure that we are able to deliver customized and incredible therapies, because of which we are able to produce these results consistently for these patients. You could also visit our website and look at all the testimonials we have of different patients of ours with different situations who have not only recovered well, but many of them are back at the close to pre-morbid level of functioning. In a similar way, we have a process for spinal cord rehabilitation, whether it's at the cervical spine level, the dorsal spine level, or the lumbosacral spine level. And this is where we have different programs available, from seating mobility to managing the bowel bladder care to managing the pressure source and other points, medical issues, and going all the way to spasticity, pain management, designing their own wheelchairs, to designing their the assistive devices that they require to be able to function well, even if the disability does not recover completely. Re-establishing this self-confidence and belief in themselves in these spinal cord injury patients, many of whom may not recover completely to the pre-morbid levels of functioning, is very important aspect of getting them back into the community and becoming a productive member of the society. When you come to Neuro for rehabilitation, we can either admit the patient in the ICU situation if that's what he requires and start right from there, or there are many patients who have already been treated at other hospitals who are still unconscious, on a tracheostomy, on a feeding tube, who are still bedridden, unconscious to semi-conscious, and even such patients require what is called as intensive inpatient rehabilitation. We have a complete system for that, where in such inpatient rehabilitation happens. Till that time, we're able to close the tracheostomy, change the feeding tube to probably oral feeding, patient has moved to the chair, probably even walking to the bathroom with some support, and has regained the basic level of consciousness. Once the patient has reached this level and he is medically stable, they do not require to be in an acute care situation for two reasons. Number one is the costs are very high in acute care situation, and number two, they need a home-like atmosphere to hasten healing. So having considered this request of patients and the fact that they cannot live in the normal homes or their homes are too disabled unfriendly, Neuro has launched a residential rehab facility. Residential rehab facility is like a house which is designed for neurologically disabled patients, where the patients will live there with their family member and then are wheeled every day, morning and evening, to the rehabilitation center which is just next door, and where 4 to 5 hours of intense, customized, need-based rehabilitation is done, 1, 2 or 3 months, following which they will be able to get back to their house and the community. This is a very unique model which most rehab centers or hospitals in the country do not offer, and this is where we actually have the cutting edge level to help people get back into the community.